HIV remains to be a significant public health problem in the United States. However, unlike in the 80s where people would die due to AIDS is much less common these days. Unfortunately, people with HIV still live significantly shorter lives than those living without the virus. And why is this the case? Don't we already have effective medications to treat HIV? And yes, we do have effective medications. However, having these medications alone is not sufficient to address this lifespan. Hello, I'm Rivera, and let me tell you how I'm studying this issue and how my research will hopefully help address this lifespan gap problem. So for people with HIV to live full, healthy lives, they need to achieve a state called long-term viral suppression. This means that the virus levels in their blood is so low that when the machine tests their blood, the machine is not able to detect any more viral particles in it. This is important because at low levels, the virus can still cause damage to the body, putting the person at risk for heart disease, cancers, and all those nasty diseases that would cut their lifespan short. However, only 50% of people in the United States are able to achieve this people with HIV are able to achieve this long-term viral suppression. And so we ask, why is this the case? The requirement to achieve this state of suppression is long-term as continuous access to medications. And this access is affected by social factors such as income, discrimination, housing, and mental health disorders. Solving these problems is a very big and complex endeavor, and we need all the research that we can have. However, current research tends to simplify things and treat these factors in isolated ways. And so the impact is our recommendations based on these research would just focus on one or two factors at a time. Unfortunately, people with HIV live with multiple social problems at the same time. And these interventions would fail to help them adequately. Reality is so much more complicated. These social factors interact and get tangled up. So in my work, I try to embrace this complexity and try to explore different ways how to model how these social factors interact to affect long-term viral suppression. Hopefully, through this work, I can help improve how policies and programs for people with HIV are implemented and delivered, and eventually address this lifespan gap problem. Thank you for listening.